In the meantime, Tuesday, West Virginia Governor Jim Justice issued an executive order suspending all elective surgeries and procedures in the Mountain State to preserve supplies and equipment for critical medical personnel. One procedure that falls under that order is abortion. 13 News reporter Haley Kosick joins us now live in the studio to explain how pro-choice advocates feel. Haley.
Lily, the term elective means any medical procedure that is not an emergency in preserving a patient's life. Pro-choice advocates believe this executive order was not issued to protect West Virginians, but rather to fuel a political agenda.
This is being done to conserve our personal protection equipment for our frontline healthcare workers that are battling this terrible virus.
On March 31st, Governor Jim Justice issued an executive order immediately halting all elective surgeries in West Virginia, which includes abortions.
This declaration is broad-based. It applies to all facilities. We've had some questions. Yes, it also applies to abortion facilities as well, but it's a broad-based prohibition. And obviously, we're going to continue to work with people to make sure that the governor's declaration gets enforced.
Elective means any surgery or procedure that can be scheduled for a later date or isn't time sensitive.
Because of the state restrictions that West Virginia has passed, this is actually a time-sensitive essential medical procedure because they can't come back and get it done at a later time. And there are laws that would not allow them to do that.
In West Virginia, a woman can only get an abortion up to 20 weeks of pregnancy. Pro-choice advocates say lawmakers are using the coronavirus to stop abortions, arguing women are more at risk who are seeking to obtain abortions out of state during this outbreak.
Folks are going to start trying to take precautions and take matters into their own hands, try self-abortions at home, which is going to lead to more individuals needing to go to the hospital for emergency care. During a pandemic, why would we want to do anything that's going to increase folks needing to go to the hospital? Because the people who are at the hospital, those people who need that care right now, are sick.
Now, West Virginia is one of 6 states that have similar executive orders, including Alabama, Iowa, Ohio, Oklahoma, and Texas. Reporting in studio, Haley Kosick, 13 News, working for you.